All I gotta do is put my mind to this shit. Goddamn. Cancel out my ex, I put a line through that bitch.
Okay, so what's my basic search pattern for looking at a knee? Basically, first thing I do is I always zoom in. I zoom in so I can get a good spatial resolution and really understand this anatomy. And what am I looking for? I'm not really looking for obvious fractures. Sometimes you open up a film and you see a huge fracture and the injury's right there. I'm looking for more or less subtle fractures, the fractures that other people aren't going to see. What are those fractures? Basically, a subtle fracture of the tibial plateau. That really comes to mind. So I'm really scrutinizing this tibial plateau, looking for any subtle break in this, any crack in this, any depression of the articular surface, or any area of sclerosis within this marrow bone, because that could be an early sign of a fracture. I'm also doing the same thing looking at the fibular head, and I'm kind of looking in this general lateral joint line region, because this is a common region for avulsion fractures. You might just see a thin fleck of bone. It may not seem like a huge injury, but actually that can mean a lot internally, and especially in regards to the soft tissues. I'm also looking at this patella. You don't see it well, but you see it well enough on the frontal. It's overlapping the femur, so I get a good look of it in the frontal view. And important thing to note is there is a normal variant called a bipartite patella, and you just want to make sure you don't mistake that for a fracture. On the oblique view, I kind of do the same thing I do on the frontal. The nice thing about the oblique is it gives you just a slightly different view, so an abnormality that you may not pick up on the frontal might be apparent on the oblique. You definitely want to scrutinize it too. Again, you see a little bit more of the patella, you see it rotating out. I definitely say the lateral view is a very important view on knee plane films. I basically look right here and look for any evidence of a joint effusion. If I see a joint effusion, it could be degenerative in etiology. It could also mean that there is a subtle fracture of the tibial plateau that's leaking marrow, fat, and hemorrhage into the joint space. I also like the lateral because it gives me another view of the tibial plateau. Here I can see the AP extent of the tibial plateau, so I can really scrutinize this again, looking for fractures. I get a nice view of the fibular head here. I get a nice view of the posterior aspect of the joint, and I get to see the femoral condyles very nicely in this lateral view. Also want to point out I look at the extensor mechanism because even on plain film you get a nice evaluation of the quadriceps tendon and the infrapatellar tendon. Okay, so let's jump into a case so I can kind of show you this search pattern at work. Here is a view of the knee. I'm basically scrutinizing this tibial plateau, scrutinizing this region, looking for any subtle fractures. As I come to the lateral, I notice a very large suprapatellar joint effusion. A normal measurement is about 5 millimeters. This is 2 centimeters. So this is a very large joint effusion. There's also internal fluid level. I can see there's a change in attenuation of this fluid. There's some lower density fluid here and higher density fluid here. This is concerning for what's called a lipohemoarthrosis, basically a fat and hemorrhage fluid collection in the joint. So I would be highly suspicious for a tibial plateau fracture that is radiographically occult, basically not seen on X-ray. So because we suspected a tibial plateau fracture, we got a CT of the knee. So here are the CT images. I have a coronal here and I have a sagittal here. You can see here on the coronal, here's a crack in the central tibial plateau. And you can also see that there's some compression of these trabecula, which is actually just a very subtle sign of fracture. You can see how subtle the fracture really is. On the sagittal, it's easier to appreciate the step-off. You can see that this cortex is continuous here and it has a subtle break right there. Right here, so there's definitive evidence for fracture here. This is a basically subtle lateral tibial plateau fracture, and basically we made this diagnosis and the patient was able to get appropriate treatment. So I hope this video was helpful. I hope you can see how subtle some knee injuries can be, and these are exactly the kind of injuries that we're looking for as radiologists. So thank you for watching. I'm Sarel Gaur MD. Please subscribe for additional content.